Good afternoon, everybody, and welcome to today's webinar, Managing Difficult Conversations. My name's Mark Winwood, and I'm a psychologist and also the Clinical Director for Psychological Health for AXA PPP Healthcare. So let's run straight into it. Difficult conversations. All of us managers have to have them, whether we're telling an individual that their job role is going to change, if we have to address poor performance, or we've recognized that one of our team members aren't coping very well and may have a health or well-being issue. They are an inevitable part of our role as a manager. You know, we may have had experiences in the past where these conversations might not have gone to plan, or they might have gone quite badly. An employee may have come angry with you and verbally lashed out, perhaps, or a direct report may have left your meeting in tears. And as a result of these sort of negative experiences, sometimes we try and avoid having these exchanges where we possibly can. But that's not the way to manage workplace performance. And the key is to learn how to handle them in a way that produces a better outcome and less pain for you, less pain for the person you're talking to, and potential growth and better engagement for both the individual and the teams. Now, as I mentioned just a second ago, I'm actually a psychologist, and I have an issue with the term difficult conversations, even though that's the title of today's webinar. If you're gearing up for a conversation that you've already labelled as difficult, you are more likely to feel nervous and upset about it beforehand. If we could try and change our mindset a little bit and try and reframe these conversations, these challenging conversations, in a more positive, less binary way, for instance, perhaps not seeing it as giving negative performance feedback, but having a constructive conversation about development, for example. A difficult conversation, or a conversation we're labeling as difficult, tends to go best when we think about it as just a normal conversation aimed at improving performance, aimed at improving well-being, and aimed at improving engagement. And today is aimed at exploring how we can perhaps normalize these conversations that we need to have, and conversations we've perhaps found a little bit difficult in the past. If you have any questions as we go through today's webinar, there is a form on the front page of the webinar, so please do feel free to write any questions that you have in there, and if we have time at the end, I will go through as many of them as I possibly can. We've already had questions already, which is great to see. And hopefully the question I've already had about how do we actually give negative feedback, perhaps reframing is a really good way to perhaps introduce a piece of information that you need to give in a slightly different way. So maybe that goes part way to answer that question already. So let's move on to think about what we're going to cover in today's webinar. Okay. We'll start off by looking at perhaps what the business challenges are of having challenging conversation. What happens if we don't address behavioural and performance issues? You know, evidence suggests that, we have a moral responsibility and a duty of care to support the well-being of our people. But also evidence tells us that there's also a financial impact as well of having a workforce that, is performing well, and we've got some statistics on that I'll share with you in a second. Okay, what are the signs, what are the symptoms that we can look out for as managers, which might indicate that an individual might require a little bit of support in order to perhaps address a performance or a behavioural issue in the workplace? What sort of preparation and planning should we be doing as managers to embark upon these conversations with individuals? What should we think about up front in order to engage an employee in this conversation? What can we do to address performance issues? And I've also got a few examples that we can go through of different scenarios which we can explore in order to actually perhaps think about how we can plan and how we can prepare for different difficult or challenging situations in the workplace. How can we create a culture of openness where we can normalize these conversations with individuals, but also where individuals feel more comfortable engaging in their own well-being agenda and feel more being more able to disclose difficulties that they're having themselves. And obviously, the earlier an individual is able to disclose any problems they're having, then the chances are we're able to ameliorate any of the negative consequences much, much earlier on of some of the difficulties that that individual may be experiencing. And finally, last but not least, how can we support our employees using the resources that are available? But also, as a manager, one of our most important professional obligations, responsibilities is to look after ourselves. So what might also be available for our teams, but also for us, to support ourselves managing difficult situations in the workplace? As promised, a few business challenges, a few facts and figures. UK businesses are missing out about £84 billion a year because of poor quality people management. So managing our people or manage our people badly is costly. About £70 billion per year is the cost associated with mental health difficulties in the workplace. And again, that's due to absence, but also due to presenteeism, where individuals are perhaps at work, but perhaps aren't firing on all cylinders, or aren't coping very well, or unable to concentrate because of the psychological anguish they're experiencing. But we also know, presenteeism is a massive issue. 67% of employees have come into work when they're not fit to be at work. And although there's no immediate cost, as it said on this slide here, it's just as bad for business in the long run. And if we can identify, perhaps earlier on, those individuals who may be struggling by virtue of their behaviors or by virtue of their performance, and refer them and direct them towards support and be proactive in managing these individuals, we do have an opportunity there to try and bring down some of these costs associated with perhaps poor performance and difficulties in the workplace. Moving on, I've got a quote for you here, and I'm going to read it because it's one of mine, so I can. Handling difficult conversations requires skill, and it requires empathy. But most of all, it requires the courage to go ahead and do it. The more we can normalize, the more we normalize something and make a habit of facing issues head on. And that's what I mean when being proactive in managing difficult situations at work, the more comfortable we will be, or you will be, at carrying out the task in hand. And as a result, you'll build your own skill set. So your own sense of self-worth, your own sense of self-efficacy can increase. You'll have a stronger skill set as a manager. You become a better manager, but also you have a more productive team. When it comes, to proactive people management can lead to increased health and increased well-being within a team. It can increase and improve both individual and team performance. It can increase individual and team engagement. It's also a chance, if someone has been helped, been supported by you as a manager, there's the opportunity for that individual to become a bit of an ambassador of assistance to other people within the organisation. And managed well, the most difficult situations, the most difficult work situations can result in growth. But we also know that ignored, avoided, and not managed well can lead to the opposite. It can lead to a reduction in productivity and a retraction rather than a growth. Let's move on and look at a few of the barriers to perhaps having some of these conversations we label as difficult. So what might they be? Avoidance is a very common one. It really is. When we're worried, when we're nervous about doing something, we can sometimes avoid. We really can. We can brush things under the carpet. And if we avoid things, we also, tend to sometimes procrastinate. And we give ourselves a message, a negative message. And the negative message we're giving ourselves is we can't do it, we can't do this. So in a way, it starts to diminish our skills. So not only does it impact on the message, but it also impacts on the manager's self-confidence. It doesn't address situations, and it also means the situation could well deteriorate. So avoidance is a very, very common barrier. We avoid things. What we also do is we become fearful, and fear can get in the way. We're fearful of getting things wrong. We're fearful of upsetting people. We're fearful of upsetting a relationship. We're fearful of getting into trouble, saying the wrong thing, causing litigation. All of these things well up inside of us. Fear and avoidance also perpetuates stigma, if you think about it, doesn't it? It really does. Fear of getting it wrong. We don't want to upset people. Uncertainty is another major issue. We'll never, we can be uncertain of how someone will react, or we can be frightened, so linked to fear as well, of what someone's reaction might be. The truth be known, uncertainty is one of the most certain things in life, isn't it, if you think about it? And the more we can tolerate certainty, the more we can accept that uncertainty is the norm, the happier and the more functional we tend to be honest with you. We'll never know how someone will react. And we can never, ever assume how they will react. Asking ourselves sometimes, what's the worst thing that could possibly happen? What's the worst thing that could happen as a result of having this conversation can be really helpful. It can really help to address that uncertainty and our nervousness around uncertainty. Another great question is what's the worst thing that could happen if we don't have this conversation? Again, that can help spur us on and help break down some of these barriers. Relationships, concerns that relationships or these conversations will mean that a relationship will deteriorate. It's always a challenge for a manager, isn't it? But, what is the role of a manager? It's not to be everyone's friend. It is to preserve relationships as much as possible. But think about what the purpose is of a manager and the purpose of the conversation that you might be having. Relationships will most certainly deteriorate if the problem continues that you're actually experiencing. And if you think about it, not only the relationship with the individual might deteriorate, but also the relationships with other members of the team will also deteriorate. So relationships can deteriorate by virtue of avoiding, by virtue of not having the conversation. Policies and procedures are really, really important. To have those at your side when thinking about or planning any difficult issue that you're experiencing with a member of staff, it's great to have that. It's great to have that resource. Make sure you have them by your side when you're addressing any performance issue. It helps you to understand what you can do and what your role is as a supported manager. It might have information about the employee assistance program that you can use as a referral resource, a HR helpline, which really, really might help you. Because increasingly, line managers are becoming more and more responsible for management and performance, traditional HR functions. So having HR support can be really, really helpful, especially when you're experiencing a barrier, perhaps, to having some of these conversations. Okay, let's move on now to look at engaged employees and what engagement can mean. Engaged employees obviously have a massive, massive impact on businesses. It can have an impact on product profitability. So for example, engaged employees, here's some statistics for you here. Engaged employees generate 43% more revenue. It has an impact on retention. Here are some statistics again. 87% are less likely to leave if they're engaged. They're more likely to become advocates of the employing organisation. 67% of them who are engaged will become advocates. Less sickness absence happens with an engaged workforce, and more likely to meet the expectations and excel when it comes to customer satisfaction. So, managing difficult conversations well, managing performance issues well, can well increase employee engagement. It can build a more effective team. And obviously, effective teams model more positive behaviours. But also, a proactive manager building an engaged team can also model the sorts of behaviours that you might wish your team members to reflect and to also carry out. It's also demonstrating a management strength to be proactive. You're not ignoring problems, because we know that ignoring problems just erodes engagement and workplace satisfaction. A manager's role is to be proactive, but also to sometimes manage the stresses, pressures, and contain some of the anxieties within a particular team member. If you're demonstrating strength by being proactive and addressing difficulties in an organization that can really, really help members of your team feel far more comfortable with any anxiety that might be around. You're demonstrating strength, you're demonstrating reliability, you're reducing the workforce's nervousness. It showcases you as a strong manager and sends a really, really strong message to your team, makes people feel far more comfortable having a manager they can rely on, and also builds what we want to see, which is engagement. Let's move on now to spotting some of the signs and symptoms that you might recognize that may indicate that an individual might be experiencing a personal problem that can impact their ability to do or perform well in the workplace. So you might notice someone's behavior is out of character. Someone who's always been quite laissez-faire and laid back is all of a sudden snapping everyone's heads off. You might find that an individual has become withdrawn, not socializing anymore at your team social functions, or not taking part or being engaged in any team meetings, and looking detached or appearing detached when having one-to-one meetings or even gatherings in groups. Perhaps losing focus more easily, losing concentration and inability to concentrate. Increasingly sensitive, maybe taking things very, very personally. Maybe catastrophizing, maybe seeing everything in quite a negative way and becoming increasingly sensitive to comments and messages that are going around the office. You might recognize that there's been a deterioration in an individual's performance, and you may recognize that the quality of work has deteriorated. Again, someone may withdraw and avoid team participation in team groups, in team meetings, or again in team social functions. You may recognize that someone has changed in physical terms. You may recognize that someone appears very, very tired. You may recognize that someone is nodding off, falling asleep at their desk, looks exhausted. You may recognize that someone is gaining a lot of weight or losing a lot of weight. Their appearance may have changed. They may be no longer taking care in their appearance. All of these things may indicate that someone is struggling potentially with a mental health condition or perhaps a personal problem. Poor timekeeping is another one. Mood changes, again, someone who's very labile in their mood maybe becomes very, very sad or extremely happy. Again, it doesn't necessarily mean just because someone's crying they're experiencing high levels of stress. People do cope and respond in very, very different ways. And so it may be that someone has a rictus grin on their face at all times. Again, could be a sign that someone's not coping very well. Irritability, signs of fear, worry, anxiety, high levels or changes or regular absenteeism may indicate that an individual's perhaps struggling with an alcohol issue or a drug issue. If you recognize certain patterns of absence, again, can indicate there may be a problem going on there. Also, denial or ignoring physical problems, again, could be a sign that an individual is experiencing some difficulties. And again, a proactive manager should perhaps think about having a conversation with an individual about what you have noticed, the changes in behavior, the changes in mood, the changes in attitude, the changes in thinking style, or the changes in physical appearance that you've noticed within an individual. Let's move on now to think about what we can do in order to approach and plan a conversation that we might have labeled as difficult, or a conversation that might mean addressing some of the things that you've noticed or some of the changes that you've experienced within an individual within the workplace. Okay, so addressing performance issues, this is what we'll touch on to start with. And then we'll start looking at the preparation for some of these conversations. Preparation is absolute key. I'm not suggesting here that you script a conversation, because scripted conversations look very, very stilted and not very genuine. But the sorts of things you need to think about in order to prepare for the conversation and the outcomes that you're expecting. But also to prepare for some of the barriers or some of the challenges that you might have already anticipated could occur. So preparing is absolutely key, and preparation can lead us to mitigate some of the negative consequences. And we'll also then start to look at some specific scenarios. So maybe that an individual is experiencing cancer, maybe an individual is experiencing some mental health difficulty, maybe an individual experienced a bereavement issue or a long-term absence issue, let's look at some of the key strategies associated with managing individuals using those particular scenarios. It's really important to remember, however, that I'm not being prescriptive here in any way, shape or form. It's really just suggesting some of the idiosyncrasies that might be associated with these particular scenarios, if you like. And also, how can we create an open culture? How can we encourage team members to engage and participate in their own well-being agenda? But also, as managers, how can we be open to having conversations with our team members about their experiences, their emotional experiences, their personal experiences, the difficulties they're having? How can we be open enough to allow individuals to have those, feel comfortable enough to have those conversations with us, with the knowledge that they'll be dealt with respect, with dignity, with confidentiality, but also with a hope that actually that manager can assist in some way, shape or form. Okay, so moving swiftly on, let's have a little look at addressing performance issues. And I've got here, or I'm going to suggest here, my top 10, if you like, top 10 points when it comes to addressing performance issues in the workplace. So, number one really is to be really clear about the issue and to prepare for the conversation, to ask yourself, a couple of important questions. What exactly is the behavior here that's causing the problem, and what's the impact that this behavior is having on the team or on the organization? By reaching clarity for ourselves, we can articulate, or we're more likely to be able to articulate really succinctly in 2 or 3 statements. If we're unable to do this, if we're able to be really clear of what's going on, we risk going off at a tangent during the conversation and lack focus, and that can help us or can assist in derailing the central issue in the conversation and can sometimes sabotage the whole conversation. Clarity will also increase your confidence. If it's a concern you have regarding an individual's well-being, by being direct and by being coherent and by being confident, you can also help that individual. Because if someone is experiencing maybe a mental health difficulty that they felt they've been really good at hiding in the workplace, but you need to have a conversation about it because you've recognized that individual is struggling, that individual may be very frightened. If you're really nervous about addressing this situation, you're going to increase that individual's fear. By being a little bit more direct, by being confident, then actually you may have the opposite impact on that individual. They may feel a little bit less fearful if you can be less fearful. And that can be really helped with a bit of preparation by being really clear about the issues that you want to address. The next thing is really to know what your objective of having that conversation is, really. What do you want to accomplish with this conversation? What's the desired outcome? What's negotiable? What's not negotiable? What are the changes that you'd like to see by the end of the conversations, or the plans or the actions you'd like to achieve by the end of the conversation? Once you've determined this, it's really important to think about how you're going to close the conversation. It might seem very odd, especially in preparation stage, but whenever we go into any conversation, thinking about how it will end is really, really important. Don't end it without clearly expressed actions. Go away with a list of what you will do. What obstacles, what obstacles might prevent these actions from taking place? What is the person agreeing to do? What is your individual employee agreeing to do? What support have you agreed to provide? What you both agreed to do to overcome potential obstacles? Schedule a follow-up meeting. It's really important. Reach closure on that issue at hand and move it forward, and that is a good conversation because you come away with an action and a way forward. Third one, always adopt a mindset of inquiry. It's really important. Never assume. Really never assume. Spend a bit of time prior to the conversation to perhaps reflect on your attitude towards the situation and also towards the person involved. Do you have any subconscious or unconscious biases about the way that they are presenting themselves, about that individual in person, about the concern they may have. Do you have any subconscious biases or unconscious biases about mental health issues in the workplace, for example? Just by being aware of these, it can be really helpful. Your mindset will predetermine your reactions and interpretations of the other person's responses. So it pays to approach a conversation with the right mindset. Knowing a little bit about your reactions to that individual can be really helpful. Whenever I'm seeing a patient in my consulting room, I never prescribe a course of treatment or start a therapeutic approach without having a formulation of the problem. Any good doctor will not get his prescription pad out until he's diagnosed what's going on. And so the same thing, a good manager needs to apply the same principles, if you think about it. Be open to hear first what the other person has to say before reaching closure in your own mind. So this, again, is being non-assumptive. Even if the evidence, as far as you're concerned, might be really clear, there's no reason to beat around the bush, we still owe it to that person, respect for that individual, to let that individual tell their story. A good leader really remains open and seeks, greater levels of information. This openness also may help the individuals do a bit of problem solving. So half your work can be done as well by allowing that individual to be a bit more open. Manage the emotions. Number 4, really important. Everyone's going to respond differently to the conversation you're going to have. Being open to the individual's emotional response demonstrates strong leadership and higher levels of emotional intelligence. It's your responsibility as the leader to understand and manage the emotions in the discussion and being mindful to the individual's dignity and treating them with respect, even if we don't necessarily agree with them, which we might not do. You might have to respond to someone's tears. It's not uncommon. So acknowledge the tears rather than ignoring them. Offer the person a tissue. Provide that individual with a bit of time out to gather their thoughts. And recognize also that those tears may be a really important part of the communication, might be an important part of the communication of the problem that needs to be addressed. As part of managing the emotions, also be comfortable with silence. There's going to be times in a conversation when silence occurs. Don't rush to fill it with words. Be comfortable with it. Sometimes silence in a conversation allows us to hear what was said and lets messages sink in. It really does. It also has a calming effect, doesn't it? It allows us to breathe. And actually, breathing, just taking a few moments to breathe, a time out from that conversation, allows a calming of an emotionally charged conversation. Preserve the relationship, as already mentioned. One of our fears of having these conversations is that relationships will disintegrate. If we've got higher levels of emotional intelligence, we're aware of what pushes our buttons, but also aware of how other people might respond. We know that as a good manager, we try and preserve relationships and limit any collateral damage to a relationship. It takes a long time to build bridges, but only seconds to blow them up, doesn't it? Think about it. Think about how the conversation can fix the situation. Think win-win when you're going into any situation, to what needs to happen to come away with that relationship intact. Be consistent. It's really, really important. Again, demonstrating strong management. Ensure that you're fair. Ensure that you're using a consistent approach. Don't demonstrate one set of rules for one person, another set of rules for another. You may be thinking this is the best thing for an individual, but you may be demonstrating favoritism. And that erodes relationships across teams. It's, perceived inequality does not go down well in any teams, does it? We trust leaders who are consistent. So, try and be consistent to the culture, corporate values, and also accepted behaviors. And, try not to use favoritism, even if you feel it might really help an individual. Watch reactions to what I call, thwarting ploys. And what I might mean by that is responses such as, passive-aggressivism. I don't know if that's a word, actually. Someone who is passive-aggressive in their responses. Stonewalling, sarcasm, accusing. The best advice, if you recognise these are the responses you're getting, is to call it, really. To call it openly and sincerely. Say, I don't know how to interpret your silence. I don't know how to interpret your anger. recognize what's going on, and it really sort of, sometimes helps move that conversation on. Think about where to have the conversation. Is it in an office where, differences in hierarchy are very, very obvious? Is it better to have the conversation in the meeting room where, it's no one space, it's a no man's land a little bit more? Is it better to go out of the office to have the conversation? Think about where the best place is to have this conversation. And also know how to begin. I know it sounds really, really obvious, but some people are put up by having a conversation where they don't know how to start it. Again, be direct. John, I want to talk to you about what happened in the meeting this morning. Let's have a meeting tomorrow. Let's grab a cup of coffee tomorrow and have that conversation. So, think about how to begin, but being direct, being upfront, being authentic is being respectful. Don't ambush it from the get-go by not. So, let's just really quickly summarize those top tips now. Be authentic. Sickness, do not look for conflicts. Look for a way to support. Always assume sickness is genuine. Communicate. Remember, communication is two ways. Listen. Never assume. Always let that individual have their say. Always keep notes of every meeting. It's really, really important. Make sure you have notes on file of those meetings. They can be really helpful. Should you need to have follow-up, it gives a really good, accurate, I suppose, record of what you've agreed to do. And then you can share those with the individual as well. So it's important to keep notes. Stick to your policies and procedures. Don't deviate from them. It can be very, very helpful to have those on hand all the time. Make sure that you're aware everyone's an individual. Everyone is going to react in slightly different ways, so never assume. So there's a real summary of the top tips. Let's quickly go through now, because I'm aware of time and we're running out. Some of the key scenarios that I promised that we'd go through. Let's look at scenarios associated with grief. What can you do if someone's returning from work who's lost a loved one? It's a very difficult situation. Expect everyone to be different, a whole wide range of emotions. Allow that individual to go through the process that they need to go through. There are all sorts of theories out there which talk about a grieving process. The most common one is by Elizabeth Kubler-Ross, which looks at the stages of grief. What she will say, however, even though it's quite an old theory, that many people go through these stages, but they can go through them in very different orders, and they can revisit various stages. So everyone makes their own journey when it comes to grieving, when it comes to bereavement. Be available, but put boundaries around your availability. Be available, but make sure you also use the support services that are available for you and refer the individual to any support services that might be available in your organisation. You may have an employee assistance program. You may have an occupational health service. You may be aware of a really good local resource that can help people with bereavement issues. Cruise is a great resource, for example, to refer people to. Don't become a counsellor, but also be there, be available, but think about your own role in all of this. It's really, really, really important. What should you say? You can express your own sadness. It's okay to use your own emotion, your own emotional experience. That's demonstrating high levels of emotional intelligence. Keep up your support. Make sure that you can check in with that individual, get permission to check in from that individual. When it comes to time, everyone will take their own time in order to recover, in order to grow, in order to grieve following a bereavement. But be aware that certain times of the year can trigger perhaps an escalation of sadness for an individual who's bereaved. Be mindful of that. It can be really, really supportive. Also support the team members around the individual who may also be very distressed by the experience that team member who's bereaved has had. So always be mindful of the collateral impact that individual may be having on the team. So be aware of that and be aware of making sure that all team members are aware of support that's available. Cancer, again, there are various things that we recommend supporting an individual with cancer. Obviously, if someone's been away from work for a long time, that can be very, very difficult. We always recommend, trying to stay in touch with the individual even if they have been off work for some considerable amount of time at regular intervals. So the return to work then becomes less daunting and less alien for that individual. Think about how they might want to talk about their illness at work. Include them absolutely in that conversation. Don't make those decisions for an individual. There's a saying that we have in health services. We call it no decision about me without me. It's about including an individual in all stages of any communication. Find out what support is available for that individual. Find out what support they're getting, what support they might need, what you can do in the workplace in order to support an individual back to work or to cope with the treatment that they may be ongoing, to help with their cancer recovery or their cancer treatment. And it might be, it might be something very practical, like moving a desk. It might be something like a shift in work times to allow for certain medication or certain treatments. Obviously be patient. Returning to work after cancer can be very, very daunting. It might need a phased return to work, obviously be led by the medical experts involved in the care. Maybe remission. Maybe the individual is in remission. What sorts of things might need to happen if remission changes, if things should change for an individual? Bear that in mind. Supporting an employee through long-term sickness, again, some of these issues remain the same. Having a good, strong sickness absence policy, being aware of that is very, very important. Regular communication throughout the absence, again, is very, very important. What to communicate to the rest of the team? What does that individual want to be communicated to the rest of the team? Again, no decision about me without me. Also make sure that you engage employees in making, in helping make decisions. What might that individual want you to look out for, which might demonstrate that perhaps they're not coping, and how can you then best support them? And the same is very, very true when we look at supporting an individual with mental health problems. Again, that might be an opportunity if an individual is returning to work following a period of depression, for example, to help educate everyone else within the team, to help promote the support services that are available, make people more aware, give information, give material. Education is absolutely key. Again, talk to the individual about the changes that might need to happen in the workplace to facilitate their return to work. But also remember, engage with that individual on the things that they might like you to look out for, which might indicate that they're perhaps not coping, or maybe a sign that perhaps their depression has returned, or their anxiety has returned, or their stress levels have increased. Maybe you can be in a position to support that individual to get help should that happen again. As promised, we're really, really keen, in order to help people engage with the wellbeing agenda, to create a culture of openness within the organisation. And here's an acronym, not an anagram, I'm going mad here, an acronym called Be Open. And it's a really helpful way to remember to keep this sort of Be Open, openness agenda within your team. Be consistent in managing employees, but appreciate that some flexibility might be needed. Ensure that managers, that you are equipped to have conversations about difficulties a person may be experiencing. Offer employees easy access to tools that you have available. Think about what's available from your organizations. Promote mental health at all possible opportunities. Team meetings, one-to-ones. Stick posters around the office. Engage in the time to change campaign, which is there to try and break down stigma in the workplace. Educate employees about mental health. Normalize the conversations, normalize mental health issues. By normalizing these conversations, it's far, far easier, because we do normalize conversations quite often about physical conditions. We also need to promote normalizing conversations about how we're coping psychologically. Ensure you're aware of what's available from your organizations. Do you have an employee assistance program that can assist yourself dealing with difficult scenarios? Because in your employee assistance program, I'm sure we'll have a managerial consultancy service which can support you having tricky conversations with your team members. Do you have an occupational health service? I'm sure you do. Or access to occupational health facilities to help support individuals who may be having medical or even psychological difficulties in the workplace. Do you have access to training, to promotion? Do you have access to written information? Do you have access to support resources that you can promote around your office? But also be aware of all your company policies regarding mental health, regarding returning to work, regarding having difficult and tricky, but what we like to say now, normal conversations around supporting an individual to perform better in the workplace. The time is up, I'm afraid. I think I've run over just by 2 minutes. I will have a quick look to see if there's any questions I can answer, but I think I've run out of time. So that may not be possible today. But thank you very much for your time. And as I haven't had time to go through questions, what I will do is perhaps post these on the AXA PPP Healthcare website so you can actually look for my responses on there. Thank you very much for your time this afternoon. Have a good afternoon. Bye-bye.